Mederi Center is a nonprofit integrative healthcare organization founded in 1992 by Donnie Yance. Our naturopathic physicians use a patient-centered approach that combines botanical medicine and clinical nutrition, often in tandem with allopathic medicine. Dr. Susan is a phenomenally skilled and caring practitioner. She's a naturopath, an acupuncturist, a doctor of Oriental medicine, and has trained with Donnie for many, many years. She's been with Mederi Center since 2014, and she has over 13 years of family practice experience. Dr. Susan supports patients with health concerns from general wellness to chronic illness to cancer care. Dr. Susan's presentation will be followed by questions, a Q&A session. Please just enter your question in the chat box, and I'll share those questions with Dr. Susan at the end of her talk. Please help me in welcoming Dr. Susan. Take it away, Dr. Sue.
Thank you, Amy. Amy, can you confirm that you can hear me?
I can hear you.
Okay, fantastic. Thank you.
Sure.
Hi, everybody. Thank you so much for joining me. I'm so grateful that so many people have logged on and are here. I've been doing quite a few Zoom, what do I call, presentations, where I'm not the presenter. And in every one, the presenter has said, wow, it's so strange to just be talking to a computer. And now I see what they're talking about. To not be able to see the faces of everybody as I'm speaking is a little bit disconcerting. So just know that I'm grateful that you're all out there, and I hope this goes smoothly. So my interest in today, my interest in giving this pretty brief talk is just to say, how do we here at the Mederi Center, and how do I approach a cancer diagnosis? Really, when someone presents with that diagnosis, what are the steps that I go through to help make sure that I'm giving them the most balanced and thorough care that I can? As many of us know, and this is not to be disparaging of the mainstream oncology community at all, we all have our different strengths, and I think they're really frequently a very necessary piece of the puzzle, but it's very focused on the cancer. And what we find here at Mederi is people have the greatest benefit and the greatest longevity and feeling of wellness when we're really taking the whole person into account. You know, imagine that. So the cancer is a part of the person and developed out of that terrain. And so we need to take that, you know, into account as we're doing a treatment. So let me see. So I really think that cancer is best treated when we look at it within the context of the whole person, that this diagnosis didn't happen in a vacuum, and getting out of this diagnosis won't happen probably by just focusing solely on the cancer, you know, diagnosis. So I really find that individualization really strengthens the effectiveness of our, you know, therapeutics. So the way I start, kind of broadly, I think that we have three overlapping circles of inquiry, I call them, or, you know, investigations. And so the first one, normally, honestly, when I'm starting a phone call with someone, we dive right in to talk about the diagnosis. But what I think really lays the groundwork for me when I'm getting to know somebody is really talking to the person about what we'd call their health. You know, and this is, how do you sleep? What is your energy like? How do you move your body? What types of foods do you eat? And honestly, those four things are so important. And I think it's very easy to kind of gloss over those and try and head right to what Donnie would call more glamorous medicine. But this is really where our health lies. As you can imagine, I need to know about someone's musculoskeletal health. Is there an arthritis process going on, or do they have things that make it harder for them to sleep or harder for them to exercise and, you know, get all those benefits? What about your hormonal health? So of course, for women, menstruation and menopause. For men, you know, is their body starting to change as they age? Are they having different issues? What are the stressors like? You know, even things like urination. Is it smooth? Is it choppy? Is someone holding on to tension and that's creating a tendency to spasm? These are all things that are going to inform, you know, I would say generally, of course, most people that come to see us are going to have a similar, what I would call a very foundational protocol. Like, sure, most people are going to be on some turmeric, some green tea, some resveratrol, some medicinal mushrooms and things like that. But again, unless we're staying in just a very generalized model, I think the power comes from, hey, what else do I need to make sure that you are moving through your day in a really healthy way? You know, so some of that comes from my Chinese training. As Amy said, I'm a doctor of Oriental medicine and love Chinese herbalism and Chinese diagnosis, somewhat for these ideas that it gives us. Again, is someone running cold? Is someone running hot? Are they hot and dry? Are they hot and sweaty and moist? You know, what is the hair and skin like? These will inform some of the ways that we treat. You know, as an example, recently I was speaking with a patient who was complaining of diet, or that's a hard, I don't want to say she was complaining. She's right to complain about diarrhea. You know, she was having chronic diarrhea, and she was also on, you know, an herb, berberine, which can be very nice for kind of killing inappropriate gut bugs. And it has a lot of anti-cancer data on it. And it can be used, it's used somewhat in place of certain pharmacological drugs. But really, it's a really cold herb. And here she's got this diarrhea. So if you think about that, we think, okay, if her diarrhea is coming because she's hot or she's got these gut bugs that are bugging her, then that would be a really appropriate herb for her. But if we're thinking, hey, she's kind of cold and deficient and doesn't quite have this, you know, qi, we would call it in Chinese medicine, kind of this fire, like a fire underneath of her digestive kettle that really needs to cook these foods, then things are just going to be running through her. And by giving her a really cold herb like berberine, despite its kind of anti-cancer data, it wouldn't help her, you know, it would actually be exacerbating her condition. So you can see we have lots of tools to choose from, but I need to be able to pull the right ones based on your physiology. You know, another example is, you know, we see a lot of breast cancer here, of course. And, you know, plenty of my patients are kind of edgy, type A, dry. I'll put myself in this category, you know, can't sleep, you know, really operating from this kind of tight nervous system kind of a place. Versus think about someone else who I have trouble kind of getting them off the couch and getting them moving. It's easy for them to hold on to weight, or they have puffy ankles. They're holding on to all that excess fluid. For them, they sleep really beautifully, but they don't use, you know, it's their metabolism that's more of an issue. Again, if I was treating both of those women the same, you know, like, oh, take these chemotherapy drugs, you know, then I'm losing out on an opportunity to really help their system work better, and thereby have the herbs work better, have the drug therapy work better, and have them feel better, have them digest their foods and have better access to their nutrition. A lot of the treatments, when we're kind of in this, again, this kind of circle of inquiry, are, I'm not going to say they're common sense, but they're foundational and very broad. So I don't know how many of you saw my colleague a few weeks ago, Dr. Pamela Plank, but she did a beautiful presentation on adaptogens. And I kind of joke, Donnie has a big adaptogens book, and I kind of joke that adaptogens are the foundation of this clinic. They're really what this clinic was built on, because they are this beautiful recognition of sometimes what we need as humans with busy lives is not always a very specific targeted thing, but something that kind of addresses us as a whole. So it makes our hormones work better, our blood sugar work better, keeps our stress managed, keeps our, you know, adrenals working well. These are herbs that have been shown over through time to work beautifully in people that are working hard and are kind of could have a potential to burn through their vitality, or who need a little bit of oomph, who are working through an illness and need like a real support of their vitality. So I encourage you to see if you can catch Dr. Pamela Plank's longer, you know, dive into this. But again, these are kind of non-specific, very general, but very enriched class of medications or, herbal medications. We also think about nutrient-dense foods in this category. So certainly deep berries, deep greens, a real breadth in the diet instead of just, honing in and having our diets get smaller and smaller, but really exploring a wide range of foods. We need nervous system restoratives. I don't think it's any secret that Americans operate from a really stressed out place. We're not great at letting ourselves relax. And so many times we need nervous system tonics in this kind of category. And the same thing with lymph tonics. We need to help our bodies move and process, whether it's from our foods or from the things we're breathing, but that's the way that the medications can get down onto the cellular level, is make sure things aren't too sludgy and swampy. We really want, I really believe that cancer is a diagnosis of stagnation. Let's get things moving a little bit. Let's kind of clean out. So these are very general, beautiful, really broad areas that, we work with in this in this section. I also wanted to say, I think this is where internet medicine, quote unquote, can get us into trouble. Of course, you get a diagnosis or you're just a thinking person and you start jumping online and looking at things. And I don't think it individuates us enough. Of course, this is where the keto diet or the raw diet or the gluten-free diet, all of which might have be great for some people. None of these approaches are great for everybody, So I really want to help people. I want to, accept the diet that they feel comfortable with. And at the same time, let's make sure that that diet is working for them with their kind of physical attributes and their, particular system. I was just going to tell a funny story. I had this friend who I went through naturopathic school with, and forever she could never eat beans. They just upset her stomach with the expected results of gas and everything. And I saw her recently and she said, oh yeah, well I was, online and looking at diets to lose extra 5 pounds and I went on this bean diet. And I thought, my gosh, of all people to go on a bean diet. But I think it's these things, there's this compelling information online, but we forget to kind of put it into our own kind of our own systems of what would work most beautifully for us, what will work best for us. The next area of investigation that is equally as important as this, broad, beautiful, looking at the health section is now let's get a little bit closer. I know how you feel, I know how you sleep and how you eat, but now what do your labs tell us about how your machine, your body is really functioning? And this really starts to give me a closer picture on how your body is working. So very commonly, I'm looking at labs of inflammation, like a C-reactive protein. I usually specify the high sensitivity C-reactive protein, which looks at inflammation in the more towards the cardiovascular system, but it does give us a general picture as well. The SED rate. We know that cancer is a disease of inflammation, although again, as broad as human beings are, the cancers are that broad. Some cancers are very hot and inflammatory and really need to be, that needs to be a huge component in their treatment. Some are kind of slower going and just kind of plodding along, and then we can place our focus in a different way. So I certainly address inflammation again, like through C-reactive protein and a SED rate, but also through other kind of secondary markers of inflammation. Like what is your coagulation system looking like in your body? And by that, I mean, how sticky is your blood running? How prone to clots are you? It is no secret that cancer patients, as things get more advanced, are much more prone to clotting, and certain cancers, like the hematological malignancies, are much more prone to being pro-clot. I believe if we can get you feeling really well in your body, digesting and sleeping well, and get your labs really good, I don't think the cancer has as strong a foothold. If a cancer is promoting a really sticky blood situation and we're unwinding that and making that impossible, we're weakening one of the ways that it's weakening the patient, So the way I look at that is usually through fibrinogen in the blood, which is, I picture it kind of like a felt that's running through the blood, like how many fibers and tendrils are in there, kind of, preventing beautiful, healthy blood flow. And again, that comes with oxygenation and carrying away debris and bringing you nutrients. I want that happening really down on the cellular level. If things are boggy and sticky, those nutrients can't reach down into that capillary level, and they're not quite getting to that end tissue that I'm trying to have them reach. So D-dimer is another one. That's kind of the other half of the pancake, if you will. Like if the fibrinogen tells us how sticky you're running, the D-dimer looks at, hey, are you actually making clots and your body is breaking them down? So are you prone to clot, and are you actually doing it? And both of those are valid in different circumstances. I also look at your platelet count. So again, these are ways we're looking at inflammation, and I'm able to assess where I need to kind of target your protocol a little more closely. I also look at markers of angiogenesis. Angiogenesis is the ability of the body, which we need, of course, to grow new blood vessels. However, in a cancer setting, cancers can get very smart and really upregulate that path. So they are kind of like sitting in the middle of this beautiful buffet of food and calling all this nutrition to them, then they're able to grow. We don't want, of course, we need normal amounts of angiogenesis, but if that is a process that's out of balance because the cancer is kind of driving the show, then that's something I want to investigate. Like the way I kind of assess that just in the kind of, quick and dirty on the labs is looking at someone's copper level. And copper is balanced by zinc. Zinc is very involved in immune function, not just in this balance in copper. So I want people to have high zinc anyway. One of my favorite quotes from Donnie is, when someone's zinc is low, their immune system is basically in the garbage. That's what he said. I just love that. I want your zinc good, and I also want it good so it's balancing that tendency of copper to get elevated and allow for that angiogenesis. I look at hormones. Of course, certain cancers are more hormonally driven than others, but I need to know if that's part of your underlying health picture. Both, it can be adrenal hormones, it can be female or male hormones, cortisol, it, depends on the person's situation. And lastly, and certainly not leastly, or probably not even last, but another big category is blood sugar and insulin. As we know, there's kind of a very simplistic idea of, hey, sugars feed cancer. It's so much more complex than that. And one of my concerns is that someone's blood sugar dynamics are not well controlled. Not only is there the idea that that could feed the cancer, but more my concern is that creates a situation where insulin, kind of a big tidal wave of insulin has to come along to get that sugar into the cells. And insulin is one of our strongest growth factors. So you can see how putting all these things together, inflammation, coagulation, zinc and copper and blood vessel growth, your hormones, your blood sugar, now we're really starting to get down to how do I treat you, not just, oh, you have breast cancer and I need to treat breast cancer, Also in the lab section is we certainly do an investigation of tumor markers where applicable, and that's a way, kind of a nice way without people always having to get scans, although there's plenty of those, that we can kind of track things through the blood and get a sense of how are we doing. Other things I look at are lactate dehydrogenase, which again harkens back to the story of oxygenation, stagnation. Is the body using oxygen appropriately, or is it starting to flip into a different system where it can use different methods to feed itself? So again, as you can see, those really help us tailor the work that we're doing. And then lastly, so again, we've looked at you, now we've looked at your labs. Now let's look more closely at this cancer and really get what information we can from that sphere. There's looked at. The most kind of classic is, in breast cancer, is it estrogen receptor positive or progesterone receptor positive or HER2 positive? We can look much more deeply at that and look at other things that might be driving the tumor, might be influencing how it uses blood sugar, might be preventing normal repair or normal cell death. These are all things that we're going to want to be looking at in that category. Right now, we're kind of at a funny juncture in cancer care. Most of the patients that I see at this point are getting genetic testing through their oncologist. However, I wouldn't say that it's being used, I don't know, maybe as optimally as it could be. I still see, because of the way insurance is and the way licensing of drugs is, still there's unfortunately these hoops that I find patients have to jump through where, oh, you've just got diagnosed, these are your options. It's, of course, there's exceptions to everything I'm saying, but in a general way, I'm not finding that patients are having really great utility from their genetic information from the tumor. And again, let me specify. I'm talking about the genetics of the tumor. Sometimes we looked at genetics of like, what did you inherit from your family? But this I'm specifically and that's important also. Right now I'm talking about, hey, what is the tumor actually telling us? What's driving this tumor? And sometimes it's genetic and sometimes it's proteins that the genes are putting out. And I'd like to look at all of that to help make optimal drug recommendations. I'm not in the driver's seat in terms of drug recommendations, but I really like to be involved in that conversation. I'm very fluent in the, mainstream oncological medications. And I think it's helpful. I think the least I can do, well, a lot that I can do, is support patients through any side effects that those drugs cause. Just like we were saying, certain drugs cause increased tendency to clot. That's something I can really help mitigate. Certain drugs really are enhanced by working with certain herbs, and that's something I can really bring in. But even as we're trying to make drug decisions, if we're at, kind of a V in the road, hey, let's really dive into what this tumor tissue is telling us. And perhaps we can get a really creative, not just run-of-the-mill kind of like, hey, you've got this cancer second door on the left, but really dive in personally. And I think that's where this Mederi model of medicine really shines. Firstly, by not treating, everyone the same, by making sure we're valuing kind of all three of these circles, but then also in this kind of tier to really dive into, the specifics about each tumor. What I was going to say is we're at kind of a funny juncture where I do see a lot of genetic tests being done, and I'm not sure I finished the thought to say, I'm not sure we're using those really well yet to drive the best drug decisions that are possible. So I think that's what's coming, and that's certainly what we're trying to drive here at Mederi Center. So how do we put all this together? My existing patients know you get a protocol. And what that means for people who don't know me means you get a, 5 to 8 page document, mostly with herbal recommendations. And again, as I said earlier, much of that is the same from person to person. Yes, most people are going to have some turmeric. Yes, most people are going to have some medicinal mushrooms. But then all the rest of these things are really what inform how we're treating. Do I need to address inflammation? I always will be, but how much effort do I need to put towards that versus coagulation versus joint pain? I'm putting all these pieces together. Of course, I use nutraceuticals, meaning, like zinc or magnesium or alpha lipoic acid, things that can help push certain processes one direction or another or make up for nutritional deficiency. And then occasionally I'll recommend a pharmaceutical drug, occasionally an over-the-counter, but usually like a prescription pharmaceutical drug. Say this is the category where, say, metformin, which is a blood sugar drug, falls into. Of course, there's lots of herbs. That's my first go around because I think herbs work so beautifully and broadly, and they hit many cancer receptors as well. But there's certainly a handful of pharmaceutical drugs that can really enhance our treatment and kind of give us a little bit more pull when we need it. And then again, I like to be involved in the oncology drug conversation, whether that means I'm going to help with enhancing the efficacy of that drug or preventing some of the side effects, or helping find the right one for the next, thing coming down the pike. So it's a really tiered approach that's really comprehensive. Certainly we look at managing side effects, neuropathy, radiation, mouth sores, joint pain, things like that come along with mainstream treatment. And the last thing I wanted to say is I think a real benefit from having a really comprehensive physician on your team is that someone's always keeping their eye on things, on the whole picture. You know, mainstream medicine, I do think it's changing. I do see, I'll get chart notes from a lot of my patients from their oncology visits, and I'll see that it was a 30 or a 45-minute visit. So I think there's, I know in naturopathic school, there was a story that like, oh, your doctor only spends 7 minutes with you. And I don't see that. I see the doctors who my patients are working with spending a lot of time with them. However, a lot of that, again, is focused on the drug part of the conversation. And so I'm making sure that we're bringing in, hey, let's make sure that we're testing, you know, some of these other things that could be coming up as a result of the health process you have going on. So just in closing, I would like to say that, you know, my goal for all of my patients is the greatest longevity with the greatest quality of life. I think that those two things both need to be looked at. We're not looking at, you know, drug therapies that will enhance longevity but not enhance quality of life. We really want people's lives to be valuable and for them to feel well. So I'm sure you'll have some questions, and I hope this has been a useful overview of what's kind of a broader way to approach a cancer diagnosis. Thank you so much for joining.
Thanks so much, Sue.
Yeah, how are we doing on time? 1:27. Okay, great.
Yeah, we still have time here, which is great. And I do have a couple of questions so far. I am going to put our contact information in the chat box again in case folks are looking for it. And I'll start getting to some of these questions. And you know, I do want to mention that, you know, without seeing people's full medical history, we really can't speak very specifically to treating. But I will pose the questions to Dr. Susan, and we'll see if she can give some general information that may be helpful and give you some insight into how we might approach it if you were to come and work with us. So the first question I have, Dr. Susan, is I wonder whether Susan might share some insights on tips or suggestions for neuroendocrine cancer, which it seems is not affected by changes in diet. It's a relatively rare cancer, so often only specialists know about it. Dr. Susan, is this a type of cancer that we've treated before, and do you agree that diet doesn't really affect it?
Hi there. Yes, thank you for your question. Yes, we've had quite a few neuroendocrine cancers come through the clinic here, and we're pretty skilled at working with them, I think. I agree. I have not seen changes just with diet. I think this is, again, as we're saying, each case is individual, but I do think this is a place where we need to bring in a lot stronger herbal therapeutics, and also try and find some creativity around just it seems like there's just the one, you know, lanreotide or sorry, I'm not going to know how to pronounce it, but the, you know, other somatostatin analogs. And, you know, trying to find some more creative ways to look at that disease is a lot of what we do. So, yeah. Amy, what else are you seeing?
Yeah, I have. Have you had experience with patient reactions to berberine, such as diarrhea or vomiting?
Absolutely. It's a really cold herb. You know, it's traditionally used in Chinese medicine in pretty small amounts, and particularly in people who kind of have a stuck feeling in the middle. So what berberine is trying to do, kind of from the poetic view of Chinese medicine, is really open down through the center, open up and get things heading downwards. So it's exactly what berberine does. It doesn't have that effect on everybody, but yeah, that's one of its primary indications, is to get things moving downward, as many bitters do. You know, it has a place, but it's not for everybody, I don't think.
Gosh, I'm not sure I got this. Give me just 1 second. The next question, I'm not sure I captured the whole thing. Yes, okay. So clear cell carcinoma ovarian cancer survivor of 2 years, currently NED. Can you help me avoid a recurrence?
That's our goal. That's our #1 jam here at the Mederi Center. So again, I never want to make false promises, but that's exactly what we try and do. That's exactly our work that I just talked about. You know, we'll look at where do your risk factors kind of still lie, and how do we mitigate those? How do I get your, circulation optimal if that's your issue, or inflammation if that's the issue? I really take a deep dive into your health and do everything I can do to get your terrain, kind of get your soil as inhospitable to a recurrence as possible. So yeah, I've worked with quite a few clear cell patients.
This is pretty specific, but you'll see what you can do with it, Sue. Have you any information on what can help increase platelets below 10 and hemoglobin running 6 to 8 with a diagnosis of AML, both on and off chemo drugs?
Sure. Yeah. Of course, there's lots to be said in that, so it's a bone marrow blood deficiency at this point. So the number one thing, and I'll actually tell you, this is what Donnie tends to use, and I don't know that I've ever seen data on it, but it can work really nicely, but is red root tincture. Red root is, I think, California lilac, and the tincture at a pretty high dose can be really great. Again, I'm a Chinese herbalist, and Donnie would say the same thing as a Western, herbalist but we really need to generate the blood. And this kind of segues with, everything we're talking about here. How do we get this whole system up and running better? So like I mentioned, partly it's you bringing in some adaptogens, but also really this is where the Chinese model has some beautiful blood building herbs, Rehmannia as one, Dongui, which is Angelica sinensis is another, but there's quite a few. There's, I only know it in Chinese. Anyway, there's some beautiful like blood building formulas that that we can, that I find can be really helpful. So without knowing more, I can't say much more, but.
Got it.
I have a question. Can you hear me?
Yes, we can. Go right ahead.
Okay, I'm sorry to interrupt. I came in late and I did not get the speaker's name.
Sure. Her name is Dr. Susan Saccomanno, S-A-C-C, am I going to get this right? A-M-A-N-N-O. I can write it, but I can't do it.
It's like a cheer. I'll give it to you like a high school cheer. It's very easy. It's S-A-C-C-O-M-A-N-N-O. Let's go.
Thank you. Thank you. And where are you located?
We're in Ashland, Oregon.
Thank you.
Sure thing.
Okay.
Dr. Sue, have you worked with CLL?
Yes, I have. Yep, quite a bit. And I think that's a cancer, if I can toot our horn here, that we have done really well with. I have quite a few patients who have not even have had a diagnosis but not ventured into drug therapy yet, because the herbs have just continued to shrink things and send the numbers the right direction. And again, I always want to say, everything is unique. Every disease is unique, and the human body that it's in is unique. So I really try and not make false promises, but that is something that we have worked with quite a bit here.
Real quickly, I just want to mention if anybody's interested in getting information about our services, please feel free to enter your email address in the chat box. I'm seeing a few requests of that nature. The other thing is please feel free to go to our website. You'll find all of our services and costs and descriptions there, as well as bio for our practitioners. I do have a number of more questions here. Before people left, I wanted to make sure that they understood how to get additional information from us if they wanted. Dr. Susan, back to you. Do you treat cancer independent of other doctors?
I'm not sure what that means. I like it when there's collaboration. So maybe that person can chime back in and kind of say what they mean. Do you have a sense, Amy? What do you think?
I was assuming that they meant if they're not working with another practitioner, but that's my assumption. So please clarify, and feel free to unmute yourself and speak if you'd like to clarify that question. The person who asked, do you treat cancer independent of other doctors? If you're on, let's see if I can see who that was.
Yeah. Well, you can hear,
I think Mike asked that question. Mike, are you on?
oh, we may have lost him.
I might have, and I actually have a whole lot of questions here, Sue.
Okay. Do you want to just do maybe
A few more?
yeah.
Yeah. This next one I can answer really quickly. Does insurance cover this, and do you take insurance? We are able to take insurance for Oregon residents who see us here at the clinic. And the insurance companies that we take are Regents Blue Cross Blue Shield, Aetna, Providence, and MODA. And we always recommend that you check with your insurance company, because depending on the plan, that can really dictate what the coverage looks like. And we do, if you are interested in exploring that with your insurance company, we do have a worksheet that helps you walk through the proper questions with your insurance company to really understand what the coverage might be. Okay, Sue, have you had success with multiple myeloma?
Yes. Yep. Yeah, we've treated quite a bit of multiple myeloma here. And, you know, I think we do, again, I think we do really well with hematological malignancies in general. It's just a place that herbs work for some reason. You know, there's this beautiful synergy. I didn't talk about it at all in this, but this was a short talk, but there's this beautiful synergy between human beings and the plants that we evolved with. And for some reason, sometimes I wonder, like, wow, have there been blood and hematological issues all through kind of our co-evolution with plants? Because there are some really beautiful plants that can work really nicely. And it is something that I look pretty closely at lab values, you know, at like BCL2 and LDH and, you know, the kappa lambda ratios, and that we really track what's happening based on what we're doing. So yeah, we've had pretty good luck here with that.
We have a stage 3 breast cancer, grade 3, with type 1 diabetes, and curious if there is herbal medicine that could support during chemo.
I think absolutely. I think herbal even if people jump in very gently, again, I think our protocols, depending on the complexity of the disease and where we are, everything, I think protocols can become large and more complex, but I think even with like some very basic things, everyone does better with herbs during chemo. I just see that. I've worked very closely here with Donnie for over 5 years now. I just have yet to see a case where that's not true. I just find that everyone does better when they're getting a little added support, you know, even if it's just a little, or maybe it's a lot, but yeah.
Do you treat metastatic breast cancer?
Absolutely. We treat so much. Yep.
Have you had, I'm going to kind of rush through these yeah. Have you had any experience with CRC with focal signet ring cells? I'm guessing I'm saying that right, SIGNET?
Yep, signet, yeah. I haven't with CRC. I think the only signet cancer that I've treated might have been gastric. I will say one thing I haven't said is that, again, I work here really closely with Donnie Yance, who founded this center and is kind of the purveyor of this model that I outlined to you. And he has really extensive experience. So we work as a team here frequently. And so if there's something that I can't find, you know, data on or have not yet treated, there's lots of resources here in the center for that. But I have not in the CRC setting treated signet. So.
Do you mix Chinese and Western herbalism in your protocols?
Absolutely, as much as I can. I love them both. Yeah, so I love Chinese medicine. Yeah.
I have iron loading disease and stage 3 endometrial cancer, currently on Keytruda. Can you help?
Mm-hmm. Yeah. You know, in a really general way, I think this is ridiculous. I'm going to say something ridiculous. I'm going to say I think we can help everything. You know, that's not exactly true, but I really do believe, like as I was saying earlier, I really do believe that herbal medicine can broadly benefit people, you know, in a really broad class of situations. So, yeah.
Can you help increase white blood cell counts on Ibrance and CDK inhibitors and white blood counts have dropped significantly.
Yeah, certainly. I will say with Ibrance, I haven't been able to get people up to like, oh, really high, like, you know, up 4.8 or something like that. But lots of my Ibrance patients will come in, you know, being around 2.6 or something along those lines. And we can certainly get them to start swinging higher for sure. Again, we have lots of build the blood herbs. There's just so many of them out there. So, yeah.
I think I might make this the last one, Sue. Is that, or if up to you?
Sure, that's not.
Yeah. Could you describe what your principal approach would be to chondrosarcoma lung metastasis? Did I chondro or chondro?
Chondro. Mm-hmm.
Yeah, in a 21-year-old post-surgery.
Yeah. Mm-hmm. Post-surgery, did you say?
Post-surgery.
Post-surgery. Yeah. So, you know, different sarcomas are differently sensitive to different drug therapies. So aside from everything we kind of laid out, like I need to see post-surgical, how are your blood numbers? How's your inflammation number? Is there residual disease? What's the inflammation? You know, all that type of thing. What's the pain level? After getting or while I'm working on all of that, getting someone really back into renewed health, really digging into the tumor, you know, microcosm and really looking at, hey, how can we optimize the drug therapy? Because many times sarcomas can just be kind of moderately or not that sensitive to chemo regimens. So I think that's where you can really see that kind of third category shine of like, let's really dig in as much as we can at the genetics and make sure we're matching appropriately with the best drug. So
I do have one more thing because Mike did follow up. It was just
okay.
down the line. I didn't see it. He was saying, do you treat as a sole practitioner?
I do, sure. Mm-hmm. Yeah, I do like treating with other practitioners, you know, so it really depends on the situation, meaning, you know, I'm probably not the most skilled at ordering scans or things like that, but in terms of, you know, being able to care for someone, I think we do pretty well here. So.
I do have, I have one person who asked, who has their hand raised to speak. So I'm gonna unmute here. I'm trying to unmute you, Ellen.
Okay.
There you go. Sorry, go ahead.
Ellen? Hello. Oh, now I can't hear her again.
I know, I think I goofed. One moment.
Hold on. It's okay. Actually, can you hear me now?
Yes,
Yep.
thank
Yeah.
you.
Can you hear me now? Okay.
Yep, we got it.
Dr.
Yeah.
Susan, I just want to tell all the people listening, I'm 3 years cancer free, and I attribute a lot of my success to the Mederi Center. My doctors thought it was a miraculous, actually used the word miraculous. They hadn't seen my situation be that successful. And I made a booklet about this thick of all the things I did and gave it to my doctor, who was very skeptical at the time, and came back and said, wow, that was really amazing. So anybody who's listening, I couldn't say enough good things about what you guys do and how you support not only what you go through, but also in surgery. My surgery, going through the protocols that you gave me before and after, made my surgery so much better that when the nurses came to my house, they said they'd never seen anybody recover that fast. So, and I mean, I understand we're individuals and there could be something in me that's, you know, I'm just like Superwoman, but I don't really think so. But, because you know how bad it was. Yeah. But so I wanted to say that because anybody who's listening, and this is the first time I've even seen you.
I know, right? That's true. We've always just spoken on the phone, so.
Right. So anybody who's concerned about, well, can this work remotely? Yes, it can work remotely. It works very well remotely, and you're an excellent person to work with, and I couldn't say enough great things. So I'm your testimonial for today.
I appreciate it so much, Ellen. It's so great to see you. Great, thank you. Good. Okay.
Thank you so much, everybody, for joining us. I'm sorry if we didn't get to your question. Hopefully.
May I say something, please? May I
Sir,
please say something?
Sure. It's,
sure,
yeah,
go
sure.
right ahead, Bernie.
Yeah.
Hello, doctor. How are you?
Hi, Bernie.
Okay, about an hour and a half ago, I had my cystoscopy again. My bladder cancer and no tumor.
Congratulations.
So it's the herbs that are really helping. I mean, my experience is that I got Donnie's book and I read it and I go into it and I think about what these herbs actually do. And I thought I knew quite a lot about it. I didn't know very much at all. There's just so much to know, and I know most people can't know everything about it, but they can get a better understanding through Donnie's books on exactly what the interaction is between us and herbs, and that they're really a great gift from God to keep us healthy. So I want to thank you for keeping me healthy for the last 2 years via bladder cancer. Thank you so much.
I'm so glad. Hey, and you know what? One thing I'd like to say, just as like a, a final word, is these patients that you're hearing from, they've been hugely involved in their own care, just like you heard Bernie say, and Ellen was the same. They were really involved, really engaged, and I think that's the other half. It's not just something that I'm, kind of spouting out from the mount. It's really people who are engaged and who do the work, and I just appreciate that so much. It just makes my job so much more engaging when I get to interact with people like this. You
Hey,
see,
thank you, doctor.
you bet. See you, Bernie. Yeah. Okay. Amy, what do you say?
I do have a question for you while I have your ear, doctor.
Oh, remember, we're on with everybody, Bernie. Remember, it's everybody.
Okay. You want me to not do it?
Yeah, you should call Molly. You should call Molly.
Oh, I got it. Okay.
Yeah.
It's a general question. All right, thank you.
So speaking of Molly, one of the ways that our practitioners are successful is that they have really good support staff. And Dr. Susan has what we call a liaison who works directly with the patient to ensure that we get all of your records, that we keep everything in order, that if you have questions around your protocol or treatment plan, that those questions are addressed in a timely and thorough fashion. I think we have a great team approach here within the clinic, as well as, working with other practitioners that may be on your care team. We have a strong care team here within the clinic as well. Thanks so much, everyone. It's been really special. For me, it's been special. So thank you.
Good. Thanks, everybody. I really appreciate it. Bye, everybody.